Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be covering cardiac drugs. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. Be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, both the part 1, part 2. You can sign up for audio lessons if you're currently in the program and you are not doing so well. You have to have a really high grade on your next exam. Be sure to check out the audio lessons I have available. You can also sign up for a one-on-one private tutoring session, or maybe you just want to pick my brain about something. All of those resources can be found again at my website, nexusnursinginstitute.com. Now, without any further ado, let's get started. Cardiac drugs. First question. Which of the following patient conditions would require you to question the administration of propranolol? Here are the options: asthma, hyperthyroidism, tachycardia, and anxiety. All right, which condition would require you to question giving propranolol? Very good. Although it was kind of close, 38 of you guys chose the correct answer, asthma, but 30 of you guys chose tachycardia. Let's talk about this. Propranolol, guys, this is a non-selective beta blocker that can cause bronchoconstriction. So this is an antihypertensive agent. However, it can cause bronchoconstriction. So do you think a drug that can cause bronchoconstriction would be a good drug to give somebody with an underlying respiratory condition, such as asthma, such as emphysema, such as bronchitis, such as, tuberculosis if they have it in the lungs, or pneumonia, or cystic fibrosis, or any other respiratory condition where they already have trouble breathing? Do you think a non-selective beta blocker such as propranolol will be a good idea to give that patient? Absolutely not. Whenever you have a question asking you, what would you question? Which would you clarify? Which requires follow-up? What they're asking you is which one is the wrong answer choice. And you are not going to give propranolol or any other non-selective beta blocker to a patient with an underlying respiratory condition because it can cause bronchoconstriction, and we don't want those type of problems, right? We want to keep our license. So that's why asthma is the correct answer choice. Next question. What statement by the patient indicates a need for further teaching about nifedipine? I should avoid drinking grapefruit juice while on this medication. I should expect this drug to cause my heart rate to increase. I may experience swelling in my ankles while taking this medication. I should get up slowly from sitting or lying down to avoid dizziness. What do you guys think? All right. And the correct answer is I should expect this drug to cause my heart rate to increase. No, you should not expect that. That is an adverse reaction. Guys, there's difference between side effect and adverse reaction. A side effect is something that may possibly happen. You're going to warn the patient that it may possibly happen so they don't stop taking the drug if it happens. They already knew in advance that's a side effect of the medication. An adverse effect is something we absolutely do not expect to happen. We don't want to happen, but it can possibly happen. And we warn the patient, if this happens, you have to let us know right away because you expect the healthcare provider to augment the medication some way, somehow, to change it, change the dosage, change the medication, something, right? Nifedipine, this is also an antihypertensive agent. The drug class is calcium channel blocker. By the way, guys, you do need to know the drug classes of medications. Don't shoot the messenger. So anyway, this is a calcium channel blocker, and we expect for it, guys. I do not accept co-hosts in the Kahoot, so please stop asking. I'm not going to accept you. Anyway, we expected to lower the patient's blood pressure. Now, something that can happen is this drug causes vasodilation, and because of the vasodilation, Possibly what may happen is the heart will try to compensate. And so we'll see something that's called reflexive tachycardia, where the heart rate increases. But guess what? That is an adverse effect. We do not expect it to happen. We do not want it to happen. You're going to teach that patient, if it happens, they need to let us know right away. That's not an expected effect of the drug. Now, the other ones are expected effects or things that could happen. And that's why it would not require further teaching. Because whenever a question asks you which requires further teaching, what it's really asking you is which one is the wrong statement, right? So where it says I should avoid drinking grapefruit juice while on this medication, absolutely, because the grapefruit juice can cause adverse reactions with the drug. I may experience swelling in my ankles while taking this medication. Absolutely could be part of that vasodilation that happens. And also, I should get up slowly. Why? Because of the orthostatic hypotension that may happen. All of those are true, right? But expecting the heart rate to increase, that is absolutely false. Again, reflexive tachycardia is an adverse effect that we want the patient to report if it happens, because something's going to have to be changed. We don't expect it and we don't want it to happen. All right, what is the primary reason for administering morphine sulfate to a patient with myocardial infarction? Here are your options: to increase the heart rate, to reduce anxiety, to relieve the pain and decrease oxygen demand on the heart, or to improve circulation. Very good. To relieve pain and decrease oxygen demand on the heart. So, myocardial infarction, patients having a heart attack, right? Why would we give morphine sulfate? By the way, this is a narcotic. Why would we give this? We want to relieve the pain because you having a heart attack, you feel like an elephant is standing on your chest. That pain will change your physiological dynamics. Okay, that's how bad the pain is. We want to relieve the pain, and we want to decrease oxygen demand to the heart. If you are having a heart attack, your heart muscles are not getting the oxygen, the vitamins, the minerals, the nutrients that it needs, right? So we want to decrease that demand because it's already not getting it as it is. So we want to decrease that demand. So that's why we're giving morphine. And guys, I say this to you all the time. When it comes to Maslow's hierarchy of needs, and we're talking about priority, pain is never a priority. Pain doesn't kill you, right? Except in certain situations, yeah, it can kill you. In certain situations, the pain is so bad, it can change your vitals, it can change your physiological dynamics, right? There are 5 specific situations, especially when it comes to NCLEX, you need to treat pain as a priority. You need to treat pain the same you would abnormal vitals, abnormal fluid and electrolytes, abnormal glucose, dehydration, everything that falls under physiological integrity. In these 5 situations, you're going to treat pain as the same. What are they? Myocardial infarction. Patients having an MI, morphine, that's a priority. 4 more. Can you guys tell me on the live, tell me what the other 4 situations besides MI that you treat pain as a priority? Does anybody know? Who's been following me long enough that they know in these 5 situations? Well, yes, MI. I just told you MI. Besides MI, yes, stones. Very good. Sickle cell, that's 3. 2 more. I'm seeing sickle cell. Come on, guys. Stones, we said stones already. All right, I'll tell you guys what they are because you guys aren't getting it. Burns, very good. One more. Cancer. Those are the 5. Myocardial infarction, sickle cell crisis, stones. And when I say stones, they could be calcium stones, they could be struvite, they could be, whatever those stones are made of. Patients having lithiasis, that pain is a priority. So we have, let me start over again because I forgot what I said: myocardial infarction, stones, sickle cell, cancer, and burns. Those are the 5 conditions. Pain is considered a priority. All right. Which of the following instructions should you provide to the patient before administering sublingual nitroglycerin? Swallow the tablet with a glass of water. You may take up to 5 tablets within 15 minutes of if the pain I can't speak persists. Lie down before taking the medication to prevent dizziness or fainting. After one dose, wait 30 minutes before taking another dose. Okay, so let's talk about it. Most of you guys got the correct answer. Lie down before taking this medication to prevent dizziness or fainting. So, nitroglycerin, what's the action of this drug? Vasodilation, right? So with that vasodilation, the patient can have orthostatic hypotension. This is a safety issue. We don't want them to pass out. We don't want them to fall. One person chose swallow the tablet with a glass of water. So I know that one person doesn't know what that word sublingual means. Sublingual means under the tongue. So this is a medication that's absorbed how? Under the tongue. You're not going to swallow it. So it couldn't be that. 9 people chose you may take up to 5 tablets within 15 minutes if the pain persists. And that's false. You can take up to how many tablets? Very good. Up to 3 tablets. How many minutes apart? Come on, guys. Up to how many? Thank you. 5 minutes. Up to they can take up to 3 tablets 5 minutes apart, not 5 tablets 15 minutes apart. And last, after one dose, wait 30 minutes before taking another dose. 30 minutes, that patient might be right. Let me tell you something. If the patient's having angina, they're having chest pain, that is the heart's way of screaming out and saying, help. I am not getting enough oxygen, vitamins, mineral nutrients is being carried in the blood. I'm not being perfused. I need help. And so what happens is that patient takes the sublingual nitroglycerin and it causes vasodilation to increase blood flow, to get that oxygen to the heart. That just like every organ in your body needs to be perfused, your heart muscle, the heart is a muscle, needs to be perfused as well. Okay? All right. Which of the following instructions should you include in your patient's teaching plan about isorsabine? Take this medication at the first sign of chest pain. You may experience headaches as a common side effect of this medication. If you miss a dose, double the next dose to catch up. This medication works immediately to relieve acute chest pain. What do you guys think? Very good. You may experience headaches as a common side effect of this drug, and that is a common side effect. This medication is what? It's a nitrate. But let's be more specific because you have to know this. It's a what? A long-acting nitrate. So it's not used for acute conditions. It's for long-acting. And because of the vasodilation action, the patient very well can get headaches, right? When patient has headaches, people have headaches. What are one of the things that they do? If they have a headache, they'll drink coffee because they know that coffee causes the opposite vasoconstriction to help the headache go away. All right, let's talk about the other options. Take this medication at the first sign of chest pain. No, it's not for acute conditions, not for acute chest pain. Okay, it's for long, chronic conditions. It's a long-acting nitrate, so that's false. I'm happy nobody chose. If you miss a dose, double up on the next dose. Never in the history of nursing do you teach that to a patient. Oh, if you miss a dose, just take 2 next time. Absolutely not. And then this medication works immediately. No, it doesn't. Again, it's long acting. So I'm happy most of you guys got this correct. True or false? Captopril, an ACE inhibitor, can cause a persistent dry cough as a common side effect. Is this true or is this false? Very good. True. That's true. And I'm not sure of, I don't want to say the word chemistry because that's not the word I'm looking for. Genetically speaking, I'm not sure why this happens, but that dry cough that we see in patients that take Captopril, very often we see it in Black people. Why? I'm genetically speaking, I have no idea why, but we see it more in, Black people than Caucasians or anyone else. And also, by the way, so if the patient experiences this, there's so many other antihypertensive agents on the market that are just as effective. The patient doesn't have to suffer with this cough. The healthcare provider is just going to go ahead and order another type of antihypertensive agent for this patient. All right, a therapeutic effect of heparin is monitored by measuring the patient's INR, which is international normalized ratio. Is this true or is this false? Very good. This was close though. Almost half of you guys chose true. All right. So heparin is an anticoagulant. And the test we use for heparin is a PTT. And I'm going to teach you guys a trick to remember the difference because I see this all the time. You guys get confused between heparin and warfarin, the PTT, the INR, and slash or PT INR. So let's talk about this. You know how heparin starts with an H, right? Think of a capital H. A capital H kind of looks like two T's. T and T. You put the two T's together, it looks like a capital H. That's how you'll remember heparin goes with PTT. All right. Where warfarin goes with the PTINR. That's how you remember, or at least that's how I remember. Okay. When you see heparin, just think of heparin as a capital H. Two T's together gives you that capital H, PTT. That's the test. Okay. By the way, when a patient's on anticoagulants, you're going to be concerned about bleeding because the patient's going to be at risk for bleeding. So you're going to make sure that the patient's safe. They're safe in the home. You're going to make sure that you teach them to, if it's a male or a female, actually shave with an electric razor. You're going to teach them to make sure that they monitor, their sputum and urine and feces, or if they brush their teeth and they spit out, you want to make sure that they don't have any internal bleeding because they are at risk for bleeding. All right, ordered response. Prioritize your instructions when teaching your patient about losartan. Here are your choices. Assess the patient's vital signs and educate them about the side effect and adverse effects. Check the patient's renal function and electrolyte levels. Administer the medication as ordered. Ensure the patient has no contraindications. What are you going to do first, second, third, and fourth? You guys that are on the live, give it to me in order. Everyone knows what they're going to do first, but you don't know what you're going to do second, third, or fourth? Only 4 people got this medication correct, what you're going to do. All right. So the first thing you're going to do, make sure there are no contraindications. I saw somebody on the live, you said pregnancies contraindicated. Absolutely. You're pregnant, you can't take this, have a history of angioedema. Nope. Right? So the first thing is you're going to make sure there's no contraindications, because guess what? If there's a contraindication present, nothing else matters because the patient's not going to get the drug. We're done, right? You're letting that healthcare provider know, and something else is going to be ordered. So the first thing you're going to do is make sure that there's no contraindications. After we've made sure that we can actually give the drug, the next thing we're going to do is assess our patient. We're going to check that patient's kidney and electrolyte levels. Why the kidneys? Remember, guys, the kidney and the liver, these are two organs are very important in pharmacology. Anytime you take a drug, the liver is responsible for metabolizing the drug, breaking that drug down, and the kidney is responsible for excreting the drug, getting that drug out of the body. So if the kidney's not working the way it's supposed to, guess what? That patient's going to be at risk for drug toxicity. Do we want that? Absolutely not. What about electrolyte levels? Why electrolyte levels? Because this drug can increase the patient's potassium level. That's a problem. Potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything outside of that range, the patient can have cardiac dysrhythmias. So imagine patient's potassium levels already at 5, and we gave this medication. Imagine the patient's kidney function is down. They're not excreting drugs the way they're supposed to, and we give this medication, right? So after we confirm that we can even give the medication, we're going to make sure there are no other contraindications that we wouldn't have known unless we checked what? Their kidney function, their electrolyte levels, right? So we do that. Everything's clear. We can still give this drug. What are we going to do? We're going to do a physical exam on our patient. We're going to take the patient's vitals, right? And we're going to teach them about this drug. We're going to teach them about side effects. We're going to teach them about adverse effects, right? Oh, someone said, what's this drug used for? It's an antihypertensive agent. That's what it's used for lowering the blood pressure. So imagine you're about to give this antihypertensive agent, you check your patient's blood pressure, and the blood pressure is 90/60. Are you going to give this drug? No. Their blood pressure is already low. You're going to cause that patient to bottom out. What are you going to do? You're going to withhold the med and call the healthcare provider. So you have to take the patient's vitals, and you're going to do it right before you give the drug. Because if you take their vitals and you do a whole bunch of other stuff, and it's like, because usually with drugs, you have an hour before or an hour after to give, right? It's been an hour. Anything could have happened in that hour. That blood pressure could have gone down. It could have gone up. So you're going to do it right before, right? You're going to assess the patient, teach them about the medication, and then actually give them the medication. And then after you give them the medication, you're going to do what? Assess them. The nursing process, right? After you perform your nursing intervention, you need to know if it worked. How are you going to know if it worked? Well, you got to evaluate. Did it work? You're going to check the blood pressure. You're going to assess your patient. You're going to monitor them. Excuse me. Okay, let's keep going. Which of the following assessment findings would indicate digoxin toxicity? Heart rate of 110 beats per minute, serum potassium level of 5.2, blurred vision or tinge vision, yellow tinge vision, excuse me, or a blood pressure of 140/90. What do you guys think? Okay, guys. Very good. Blurred vision or yellow tint vision, or the patient complaining of, I hate to say that word complaining, but you know what I mean. The patient reporting seeing halos around their vision, nausea, vomiting, fatigue. Okay. It's important. You need to, by the way, digoxin, it's a cardiac glycoside. We love digoxin. It's great for conditions such as heart failure. Why? It increases the contractility of the heart. It makes that heart beat a lot stronger so it can push out all that fluid, all that blood, right? But one of the things is that it lowers the heart rate. So we got to be very careful. We're going to take an apical pulse for a full minute before we give this drug. And we're going to make sure that that heart rate isn't too low because it already lowers the heart rate. So anyway, let's look at the wrong choices. Wait, I forgot what the question was. Which of the following assessment findings? Okay, this toxicity. Heart, heart rate of 110 beats per minute. No, I just told you that one of the things digoxin does, it lowers the heart rate. So if the patient was in ditch toxicity, we would see bradycardia, not tachycardia. Next, serum potassium level of 5.2. No, one of the things that we also have to be concerned about when it comes to digoxin is that it can lower the patient's potassium level. So we have to be very careful because, again, potassium has a very narrow therapeutic range, 3.5 to 5. That's it. Anything outside of that, patient can have cardiac dysrhythmia. So if the patient was going through dig toxicity, the potassium level would be lower than 3.5, not higher than 5.2. So that's wrong. And last, blood pressure of 140 over 90. No, digoxin doesn't elevate blood pressure. So that's incorrect. The only one would be the blurred vision. Patient that reporting difficulty with vision, again, nausea, vomiting, fatigue, things like that. All right, type in your answer. While taking spironolactone, patients should be instructed to avoid consuming foods high in what? If the patient is taking spironolactone, you're going to teach them to avoid eating foods high in what? Type in your answer. Brenda, stop playing. Potassium, tyramine, sugar, salt, vitamin K. Potassium, guys. Potassium. Spironolactone, this is a potassium sparing diuretic, right? That S in spironolactone stands for sparing. It makes you hold on to potassium. So you're going to teach a patient to avoid foods that are high in potassium because you're already holding on to potassium. And again, for the millionth time, potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything outside of that, the patient's at risk for what? Cardiac dysrhythmias. So those foods that are high in potassium, such as, excuse me, bananas and apricots and kiwi and watermelon and potatoes, right? Those foods that are high in potassium, that patient needs to stay away from because they're already holding on to potassium as it is. That S in spironolactone stands for sparing. It is a potassium sparing diuretic. All right, select all that applies. Which of the following should you include in teaching about spironolactone? Here are your options. Avoid foods high in potassium, such as bananas and oranges. You may experience increased urination, especially in the morning. Report any signs of breast enlargement or tenderness. It may cause a drop in blood pressure, so rise slowly from sitting or lying position. Monitor for symptoms of hypokalemia like muscle cramps or weakness. You should avoid taking this medication with alcohol. Those are your options. Select all that apply. Which of the following would you include in your teaching plan about spironolactone? And actually, guys, in the last slide, when I was teaching about spironolactone, I gave you a lot of the answers already. So what do you think? Okay, guys, let's talk about this. Remember, when it comes to select all that apply, you have to treat them as true or false to increase your chances of getting the answer correctly. So when it comes to spironolactone, avoid foods high in potassium like bananas and oranges. Absolutely. Why? Because spironolactones make you hold on to potassium. They don't need any more. True. You may experience increased urination, especially in the morning. True. Spironolactone is a potassium sparing what? Diuretic. What do diuretics make you do? Urinate. That's how you get rid of all that fluid, right? So those patients that have CHF or hypertension, we need to get rid of all that fluid. They're urinating. Report any signs of breast enlargement or tenderness. Wow, only 6 of you guys chose this, and this is true, right? Spironolactone, yes, it can cause breast, and by the way, this is an adverse effect. That's why they need to report it. Because if patient experiences this, they're going to most likely they're going to be placed on a different type of diuretic, a different type of drug. But anyway, it can cause breast enlargement, breast tenderness, breast pain. Okay. So yes, that's true. It can cause a drop in blood pressure. So rise slowly from a sitting or lying position. Absolutely. Think about what it does, right? It gets rid of all this fluid, which is going to drop the blood pressure. It can cause orthostatic hypotension. True. Monitor for signs of hypokalemia. No. Because remember, this spironolactone, that S stands for sparing. It makes you hold on. It makes you save potassium. So if anything, the patient would not be hypokalemic. They would be what? Hyperkalemic. Potassium levels would be elevated, not low. So that's wrong. I'm happy only 13 people chose that. And then last, you should avoid taking this medication with alcohol. Why did only 32 people choose this? In the history of nursing, in the history of pharmacology, when did we ever tell a patient that it's okay to drink alcohol while taking anything? Help me understand. Everybody should have chosen that. Yes, you should avoid taking this medication with alcohol. You should never take alcohol with any medications. I mean, duh. Moving on. Which of the following is the most important assessment to perform before administering Lasix? Furosemide, that's a generic form of Lasix. Okay, which of the following is most important assessment? Blood pressure, respiratory rate, potassium, or glucose? I'm happy you guys narrowed it down to blood pressure and serum potassium. I love that. I'm happy about that. So let me talk about, and guys, this is nursing, where you have two answers that are correct and you have to choose the most correct, right? Because if you think about it, um furosemide Lasix, this is a diuretic. It's going to lower the blood pressure. So you definitely want to take the patient's blood pressure before you give this drug. And it's also a potassium losing diuretic. That L in Lasix stands for losing. You lose potassium. So you also want to check the potassium level. So when you have a conundrum such as this, and you looking at two correct answers, Professor D, how do I figure out which one is the right one? Always ask yourself which one's going to kill my patient the fastest. Whichever kills your patient the fastest, that's your priority, right? So I want you to think about it. Let's say the patient's blood pressure was low and you gave them the medication Lasix, or their potassium was low and you gave them Lasix. What would kill them faster? Potassium. Potassium. That potassium will kill your patient faster than the lower blood pressure. So that's what you guys got to do. And guys, that's the name of the game. In nursing, you're usually going to have two correct answers. Technically, both are correct. You have to figure out which one's most correct. And that's what you have to say to yourself. Which one's going to kill my patient the fastest? Or in the worst way. And that's going to be your answer. All right. So when it comes to Lasix that makes you lose potassium, we better check that potassium level, because guess what? If the patient's potassium level is already low, we're not concerned about that blood pressure because we're not going to be giving it. We're going to be calling the healthcare provider and doing something else. So it alleviates that whole problem. Do you see where I'm going with this? That's how you guys are supposed to think. I'm sorry, everybody that's asking for the code. This was the last slide. We're done. I'm so sorry. This Kahoot is going to be posted on YouTube within an hour. So you can go on my YouTube channel, Nexus Nursing, in about an hour and it will be up. I'm so sorry. So anyhow, guys, that's how you figure out which one is most important out of the two. And with that being said, let's see how you guys did.